Melody Taylor Stark would usually visit her husband twice a day at his Arcadia nursing home, sharing coffee and horoscopes on weekday mornings and having dinner together in the evening. But when the coronavirus pandemic struck, those visits came to an abrupt halt, for 5 months. I saw a quick decline emotionally, a lot of depression in someone who was normally an optimistic person, said Stark, an electronic health records specialist. At least a couple times or more a week, he would say, "Oh, Melody, this is no way to live." Starting in August, Huntington Health and Rehabilitation Center allowed her to see her husband, Dr. William Stark, for precisely 15 minutes once a month, she said. Her first indoor visit at the facility took place on November 18th. Later that day, her husband, who used a wheelchair and had several medical conditions, including post-polio syndrome and cancer, was whisked away to the hospital due to a decline in kidney function. Southern California nursing homes during the Coronavirus PandemicPast installments in a continuing series. The series was launched by correspondent Brenda Gazzar, participating in the USC Annenberg Center for Health Journalism's California Fellowship. The retired dentist, who was 84, died 4 days later, just days before Thanksgiving. His causes of death were listed as a particular bacteria, pneumonia and COVID-19, for which he tested positive at the hospital, his wife said. The hardest part was knowing how much good quality of life was stolen from him in the last several months, Melody Taylor Stark said the day after her husband's death. Before lockdown, we did a lot of things to enhance as much quality of life as possible. During isolation, because nursing homes are so poor at psychosocial and emotional wellness support, people were just left in their rooms. While the nursing home did some things to ramp up activities, Stark argued that it was nothing like the person-centered care that her husband needed. The administrator of Huntington Health and Rehabilitation Center, which has 2 stars in a 5-star rating system for overall quality on Medicare's Care Compare, declined to comment for this article. The facility's owner also could not be reached on Friday. Federal guidance allows local health departments to ease their original COVID-19 restrictions placed on nursing home visitors in a phased approach based on the local situation and a particular facility's case, staffing and testing status. But because of the high COVID positivity rate in Los Angeles, we are under the strictest requirements for nursing home visitation, said Molly Davies, who oversees the long-term care ombudsman program in Los Angeles County that investigates complaints from such residents. Arguments have been made that visitors who act more as caregivers, who for example help encourage people with dementia to eat, should have more access than general visitors.